Hello, I'm Dr. Evans. For the past 25 years, I've had the privilege of being a neurologist, dedicating my life to understanding the most complex and delicate organ in the universe, the human brain. I've seen miracles happen inside these walls, but I've also seen tragedies. And what keeps me up at night, what truly drives me to speak out like this, are the tragedies that I know could have been prevented. Let me tell you about someone I'll call David. He was a 71-year-old retired firefighter from Texas, a man who had spent his life running into danger. Last month, he was brought into my care after a significant stroke. His family was shattered, completely bewildered. They kept saying, "But doctor, he just had his annual checkup. They told him everything was fine." They showed me his paperwork, and as I read it, my heart just sank. Because right there on the page was the name of a routine test he'd had just weeks earlier. A test that I believe initiated the chain of events that led him to my hospital bed. So, what if I told you that one of the most common, seemingly harmless screening tests recommended to millions could, under a specific set of circumstances, quietly raise your risk of stroke overnight? It's not the test itself that's the villain. It's the cascade of events it triggers. A quiet domino effect that the modern medical system, in its well-intentioned rush for efficiency and checklists, often fails to warn you about. A risk buried in the fine print. That's why I'm making this video. I'm stepping out from behind the sterile clinic walls to talk directly to you, person to person. Together, we are going to uncover this routine test and two other so-called healthy habits that can be silent stroke risks. If you are over 60 or you care for someone who is, I need you to stay with me. In the comments right now, please, just type "I'm listening" to let me know you're here with me. It's time to pull back the curtain. All right, let's get right into it. The first hidden danger I need to talk about is the carotid artery ultrasound. Now, on the surface, this test is a modern medical marvel. It's completely painless. There's no radiation, no needles. We simply use a small wand with some gel on your neck to look at the main arteries, the carotids, that act as the super highways for blood traveling to your brain. We're looking for plaque buildup, cholesterol and calcium deposits. Think of it like checking for rust. It sounds like the smartest, most proactive thing a senior can do for their brain health, doesn't it? But here is the truth that, as a neurologist, frankly shocks me. The danger isn't the ultrasound itself. The danger is what happens next. This is the critical part. Let's say the scan finds a blockage. Maybe it's 60% or even 70% narrowed. That number on paper sounds terrifying, doesn't it? So your family doctor, following standard protocol, does the right thing and refers you to a vascular surgeon. And the surgeon will often recommend a procedure to clean out the pipe, either a carotid endarterectomy or placing a stent. And right here, this is the deadly paradox. For a patient who has no symptoms, I want to repeat that, no symptoms. The risk of having a stroke from the procedure itself can actually be higher than leaving that moderate blockage alone. And managing it aggressively with medication, think about it. During the procedure to clear the plaque, a tiny microscopic piece of that very same plaque can break off. It gets swept up in the powerful blood flow and travels directly into the intricate, delicate network of vessels. It lodges there, and in an instant, causes the very event of stroke that the entire process was meant to prevent. It's a tragedy of good intentions. I will never, ever forget a woman named Helen, an 82-year-old from Florida. She was a vibrant grandmother. She played bridge with her friends. She had no symptoms whatsoever. A routine checkup led to a carotid ultrasound. Just to be thorough, it showed a 65% narrowing. Within a month, she was on the operating table. During the procedure, a small clot was dislodged. Helen survived, but she lost the ability to speak clearly and to use her right hand to hold her grandchildren. She went in for prevention and came out a permanent patient. Her family's question still haunts me to this day. "Doctor, did she even need the surgery? So what can you do?" This isn't about refusing tests. This is about being armed with the right questions. If a scan shows a blockage but you have no symptoms, you must become your own strongest advocate. You need to ask your doctor these critical questions. And please, write them down. Number 1, doctor, based on the latest major clinical studies, what is the statistical benefit of this surgery for an asymptomatic patient like me when compared to optimal medical management like statins and blood pressure drugs? And number 2, What is the specific stroke and complication rate for this exact procedure at this hospital, Maruni, performed by you? That knowledge is power. It transforms you from a passive passenger into the pilot of your own health journey. It's the difference between fear and informed consent. Now, let's talk about something you might be doing every single morning. That feels healthy, but could be silently sabotaging those arteries. All right, let's move from the clinic to your kitchen. We see it in every health food store. We hear it recommended for its high vitamin C, a refreshing glass of grapefruit juice, or maybe half a grapefruit to start the day. It feels virtuous, clean, and healthy, doesn't it? But for millions of seniors on common medications, this health drink is a ticking time bomb hiding in plain sight. Here's why, and this is fascinating science. Grapefruit, both the fruit and the juice, contains a group of natural compounds called furanocoumarins. It's a mouthful, I know, but what these compounds do is very specific and very powerful. They block a critical enzyme. Now, I want you to think of this enzyme, CYP3A4, as a strict gatekeeper. Its job is to stand at the entrance to your bloodstream and carefully control how much of a medication gets through. It metabolizes the drug, breaking it down so you only get the intended dose. But when you consume grapefruit, those furanocoumarins come in and they essentially tie up the gatekeeper. They knock him out of commission. Suddenly, the gates are thrown wide open. There's no one controlling the flow. A normal, safe dose of your medication now floods into your bloodstream at 2, 3, or even 4 times the intended concentration. It effectively turns a therapeutic dose into a toxic overdose. And this is incredibly dangerous with 2 of the most common types of medications prescribed to seniors: statins for cholesterol and calcium channel blockers for high blood pressure. Imagine your blood pressure pill, which is carefully calibrated to keep you safe, suddenly becoming supercharged. Your blood pressure can plummet, causing severe dizziness, fainting, falls that lead to broken hips, and even worse. It can disrupt the stable blood flow to the brain, creating the perfect storm for an ischemic stroke. A patient of mine, a gentleman I'll call Richard, 75 years old from California, learned this the hard way. He had been stable on his blood pressure medication for years. He was a model patient. He decided he wanted to get even healthier and started his day, every day, with a large glass of fresh grapefruit juice. About a week later, he collapsed in his kitchen. He was rushed to the ER, where we found he'd had a TIA, a mini-stroke. The cause, a dangerous drug interaction triggered by his healthy new breakfast habit. No one had ever connected the dots for him. Between the prescription his doctor gave him and the fruit he bought at the grocery store, the solution here is simple, but it is absolutely vital. Read the warning labels on your prescriptions. They are not just there for legal reasons. Many will explicitly say, do not take with grapefruit. But go one step further. Talk to your pharmacist. Pharmacists are one of the most underutilized resources in our entire healthcare system. The next time you pick up a prescription, ask them directly, are there any food or drink interactions I need to know about? It is a 5-second question that could literally save your life. Now, let's look in the medicine cabinet at the one pill almost everyone has and uncover the hidden risk. All right, our final stop is the medicine cabinet. A flare-up of arthritis in the morning, a tension headache after a long day, a sore back from gardening. What's the first thing so many of us reach for? It's that bottle of ibuprofen, you know it as Advil or Motrin or maybe naproxen, which is Aleve. These are NSAIDs, non-steroidal anti-inflammatory drugs. They seem so safe. You can buy them in giant bottles at Costco right next to the vitamins. But I need you to hear this loud and clear: over-the-counter does not mean without risk, especially not for your brain. As a neurologist, I don't just see the initial injury, I often see the long-term effects of how people treat their pain. NSAIDs work by blocking enzymes that create inflammation and pain signals. They're effective. But for seniors, they have a trio of dangerous side effects. First, they directly raise blood pressure. It might not be a huge jump, but a small, consistent increase can be the tipping point that pushes your pressure into the danger zone. Second, they can interfere with your prescription and blood pressure medications, making them significantly less effective. It's like trying to bail water out of a boat while someone else is secretly poking small holes in the bottom. And third, and this is crucial, they can increase the risk of blood clots. Now, this isn't just my opinion. A landmark study published in the prestigious British Medical Journal analyzed data from millions of patients. The conclusion was undeniable long-term. Regular use of common NSAIDs is linked to a significantly higher risk of heart attack and stroke. For a senior managing cardiovascular risk factors, taking daily NSAIDs without a doctor's guidance is like pouring gasoline on a fire. You are fighting a war on two fronts. I think of a patient named Brenda, a 68-year-old retired teacher from Arizona with nagging arthritis. She did what millions do. She took 2 ibuprofen every single day for years, thinking it was harmless. She couldn't understand why her blood pressure kept creeping up, despite her primary care doctor increasing the dose. She was caught in a constant state of tug-of-war, her prescription trying to lower her pressure, and her daily pills pushing it back up. She was living on the razor's edge of a hypertensive crisis, one bad headache away from a potential stroke. The message here is not never take an NSAID. Pain is real. The message is to respect their power. Your goal and the conversation you need to have with your doctor should be about finding the lowest effective dose. Ask your doctor about alternatives. Is acetaminophen or Tylenol a safer option for your specific condition? Could a topical cream, physical therapy, or even anti-inflammatory diet changes help reduce your reliance on these pills? Don't let a casual, daily habit become a critical, silent risk. Understanding these hidden dangers is the first and most important step. Now, let's bring this all together. So, today, we've walked through some uncomfortable truths together. We've talked about the hidden cascade effect of a routine scan, a surprising danger lurking in a healthy juice glass, and the silent risk inside a common painkiller bottle. Now, I want to be very clear. The purpose of this conversation is not to make you fear your doctor or distrust your medicine cabinet. It's to completely dismantle the dangerous and complacent idea of routine. After the age of 60, nothing is truly routine. Your body is a unique, incredibly complex system with its own history and its own vulnerabilities. What is safe for one person may be a risk for another. My mission as a doctor has always been to heal, but my deeper responsibility, especially now, is to empower. And I believe the single most powerful tool in all of medicine is not a fancy MRI machine or a new prescription pill. It is a well-informed patient asking the right questions. You have the right to understand the why behind every single test. You have the right to discuss the risks right alongside the benefits of every prescription. You are not a line on a chart. You are a partner in your own care. Your health is the most valuable, non-renewable asset you will ever own. And that makes you its chief executive officer. You are the CEO of you, and it's time to take charge in the boardroom of your own life. So I want you to make a commitment right now. Not to me, but to yourself. In the comments below, I want you to type 3 simple but powerful words, I will ask. It's more than just a comment. It's a promise to yourself that you will no longer be a passive passenger in your health journey. It is a declaration that from this day forward, you are taking control. If this video has armed you with even one new question to ask your doctor, if it has made you pause and think twice, then we have succeeded today. Please subscribe to this channel, and more importantly, share this video with a parent, a spouse, a friend, anyone you love.